Hi, I'm Viv, and I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees. Hope you're all doing well this Sunday morning. It's a little bit of a different time to mine and Sunny's regular weekly lives. It's purely because of our guest today. He's based over in Australia. Hi Jake, and hi Sunny as well. So I'll get Sunny on. I'll just invite Sunny, it won't be a second. But Jake is based in Sydney, over in Australia, and he's a cosmetic doctor. And we'll have a good chat with Jake about all things aesthetics and ultrasound in particular. So we certainly just invite Sunny. There we go. Hopefully Sunny won't too much. Hi Sunny.
How are you?
I'm fine, thanks. Nice to see you this Sunday morning. Yeah, as I was saying, we've got a cosmetic doctor, Jake Sloane, yes, who's based in Sydney, Australia. He's 9 hours ahead of us, so it was a bit of a play with timing for today's live. So it should be interesting. Jake has been carrying out cosmetic work for a number of years now. He works with Allergan in Australia. He trains, and he set up ultrasound training in Australia as well. So it should be an interesting time. I'm just going to send him an invite. See where he is. There he is. Won't be a second. There we go. He should be joining us hopefully soon. How's your week been anyway, Sunny?
It's been good, but I think we'll defer to Jake. And it was definitely stubborn, isn't it, Jake, this morning?
Hi, chaps. Well, it's been a great day for me. I've been on the beach with the kids, so it's been fine. Sorry to drag you out of bed.
Oh no, it's not that early here. I've done the usual Sunday morning rituals of going to the tip and getting rid of stuff. Living the best life. But Viv, obviously Jake, really lovely to have you on board, and obviously connecting with Viv so that we can talk more about ultrasound and aesthetics. But I was going to ask if you introduce yourself and to the people that are watching that don't know you, and then that way it'd be a really good start to the morning for us anyway.
Yeah. Well, first of all, hi Dr. Harris. I feel famous now. Dr. Harris has joined us. Who am I? So yes, I'm from London. I moved to Australia in 2015, and I was doing surgical training in the UK. So same as you lads, went to medical school. I was at Manchester, went back to London, did my house jobs, got into surgical training, and you know, let's be honest, it was a long slog, and I was sort of hitting a brick wall with getting a training number, as many of my colleagues and friends did, and I was like, well, what can I do? My only option is to really leave the career or move country. So I chose option 2. So yes, I moved to Australia in 2015. I was very lucky to get a great job in Sydney. Pursued surgical training for another couple of years. And to be completely honest, you know, a lot of English doctors move here, and I guess it depends what specialty they do, but surgery was pretty brutal. It was a 100-hour week very often. You know, it's a very American style, sort of you're here till you're sort of finished. There's no sort of working time directive like we have in Europe. And after a couple of years of that, I thought, shit, why have I moved country to do this? So yeah, so look, I was lucky. I won't say the whole story, but I was lucky to fall back on aesthetics, which I had already started in the UK, and now it's my 14.5th year. So I started in 2008. I did a very basic course with Adrian Richards. I'm sure you know cosmetic courses. Yeah. They're still running courses. And you know, I set up a very simple business. I was a bit like you guys. I was a solo injector for many years, sort of finding my way. You know, I probably went through all the trials and tribulations like we all do. And, you know, we can come on to that, but we talk about a lot of this stuff on the podcast. So, yes, so I left surgical training in 2017 and pursued a full-time career in aesthetics, which, to be honest, has gone fantastic. And we can talk about all the other things that I do, if you like.
Definitely. Go on, Viv. I know you're dying to ask questions.
It's really nice of you to be able to join us and talk about your life, because we've been speaking to other practitioners like Dr. Harris and Leonie, Shelker, and lots of different people around the world who deal with ultrasound in particular. And For you, Jake, I've got to say one of the things I love about your work on your feed is your stories. I've got to mention them. I just watch your stories to put a laugh on my face for the rest of the day, I've got to say. And they're just so funny. These are real life episodes that you end up in with people sending you oddball messages, I think. They're all real, aren't they?
Well, I'd literally just had another text about 10 minutes ago, and it was from a weird number from Joanna. And she said, "Hi, I'm looking for David Segal." And if you know, David's the co-host on the podcast. And I thought, they're trying to prank the wrong guy. So I sent David the number and said, "Oh, hey, someone's looking for you." But, you know, the stories, look, I think with Instagram and social media, you know, I try and use it as a bit of fun. Yes, of course, there's some serious stuff as well. But, you know, we're all here on this earth to have a bit of fun. So why not?
No, it's really nice of you to talk about that. But as you mentioned, Inside Aesthetics podcast is a big part of your work in aesthetics. Yourself and David are co-hosts of Inside Aesthetics podcast, and you produce weekly recordings, I think usually on a Friday, is it?
Yeah, that's right. So we've been going since 2019, David and I. We started, you know, not really having a clue what we were doing, both from a technical perspective, but also, I guess, the educational perspective. And we started quite broad. We did some surgical episodes and some wellness episodes, as well as aesthetic episodes. And the longer it went on, we realized our core listener are injectors and people like you guys. So I can't remember when it was, maybe a year and a half ago, we did a bit of a survey of our listeners, and we said, you know, what do you like? What don't you like? And what's hitting the mark and what's not. And it was very, very clear that the injectable episodes were, you know, the most popular. So we made a tweak. We dropped some of the wellness stuff. We're still doing, you know, the occasional surgical one. We did one with Ben Talley not too long ago. But yeah, so it's gone amazing. We're getting about 40,000 listens a month now in about 100 countries. You know, there are 4 or 5 main countries. There's obviously Australia, America, UK, Canada, and then a whole bunch of tiny countries that are still listening. And it's gone great. And the feedback we keep on getting is, you know, we love it. The stuff that you cover is quite niche. You go down avenues that we can't really get some of this information from, you know, a course or from the pharma companies and so on. We try to be very unbiased. We've had all sorts of guests on who represent all different companies. Doctors, nurses, dentists. We've had a pharmacist on. So, you know, we just want to hear from everyone in the industry to find out how we can all better ourselves. So, yeah, it's gone great. I can't really complain. It's just a lot of work. We spent about 8 hours an episode.
I think, Jake, that's one of the questions probably injectors who are probably watching now. It's something that, you know, when you start off and people say, get yourself out there, you need to do social media, you need to do a podcast, and people sort of get stuck in the mud in terms of what they want to go. So really the advice that from yourself would be that if you're starting a podcast, just get yourself out there.
Pretty much. I know, Viv, you've got your own podcast, and I know you replicate some of these talks there. But I mean, look, I think my one bit of advice isn't, well, it's get yourself out there, but also have the stamina to just keep on going. There's no point in doing 4 or 5 episodes and saying, oh God, I've got no listeners, I'm going to stop. That comes with the course of starting any new project. You're not going to be popular or successful immediately. So, you know, maybe record 5 or 6 and don't release them. So, you know, if you have a busy couple of weeks and you can't record, then you can sort of, you know, stagger them out and drop them when you're busy. But yeah, you know, just back yourself and talk about the things that you enjoy. Don't try and anticipate what others want. Talk about what you want, and you'll find your own niche. That's what I would say.
And I think that's one of the really good points looking at your feed, listening to podcasts, is that it is you. It's genuinely you, and you're not trying to essentially copy anyone or guess trends or plan out content. It's, I mean, obviously that's coming with time organically, I'm sure, but no, it's refreshing.
I used to do all the nonsense of, you know, talking about my Friday coffee and all the crap that people normally do. And then, you know, I mean, more recently, I don't know if you noticed, I don't post half as regularly because I'm not here to feed the algorithm. I'm here just to talk about whatever what I think is relevant. So I might post 7 days a week, and then you might not hear from me for 2 weeks. I get busy. But, you know, I'd rather just plan a post, and whether it's controversial or funny or just interesting, I want it to sort of grab your attention for a few minutes rather than just be boring. So yeah, that would be my other sort of bit of advice for people. Again, don't try and serve the gram or serve, you know, someone else. Do what you enjoy and you find funny, and you'll find your tribe for sure.
No, it's really good of you to talk openly about your life in aesthetics, and it was really myself and Sunny. We've been doing our weekly lives for a few months now, and we've been looking at our own journey in the use of ultrasound in our aesthetics work, and we thought with you getting into the whole area of ultrasound use in your own aesthetics work, Jake, we thought it'd be interesting to have you, but also the fact that you've been in the UK, you've also now living in Australia. It's good to get your own viewpoint and find out more about how the aesthetics life for a doctor is in another country. So it's really kind of you to do that and help us show what that's like. In terms of ultrasound, how did your interest in ultrasound begin, Jake?
It's a great question. I heard about ultrasound a good 3, 4, maybe even 5 years ago. I knew that Leonie was sort of the fore leader and her team, which was amazing in Rotterdam. And the first course in Australia was due to be just before COVID. I think it's like March, April 2020. And a number of us have signed up. I was signed up. We were due to fly down to Melbourne. And honestly, I think at the time I was like, well, it just seems like the thing to do. I've sort of heard about it. Let's just go and, you know, see what it's all about. But obviously that didn't happen because of COVID. And, you know, as you know, Australia sort of locked down pretty severely. So we were stuck. We couldn't do anything. And, you know, we've got very, very few people here. I'll shout out Mobin Master, a good friend of mine, Stefania Roberts. But, you know, there's not that many people doing ultrasound here with experience and skill. So even when we opened up, there was nowhere to sort of go, or no courses, or no people to sort of, you know, go and sort of spend the day with. And then I can't exactly remember how it happened. I met, well, I reached out to Leonie and Peter prior to IMCAS, which was, you know, sort of June just gone now. And I said to Leonie, actually, I want to do a podcast with you. Let's talk about ultrasound. So we met up, we actually went for dinner, we had a great evening. And I had done their course, you know, a few days before.
I've just got to pause there. Viv, don't get jealous. They got to go for dinner with Leonie.
Yeah, and I did Peter. Well, it wasn't Peter and Leonie's course, but there was a number of the gurus. So Steve Weiner was there, Stella was there, Leonie, and so on. There was about 5 trainers. This was a pre-course at IMCAS. So I did, you know, it wasn't even a day of ultrasound. It was just a station with about an hour of worth of basic training. And I've still got my photo of Leonie clapping my technique, so she must have thought I was good. I never let her live that down. I keep on reminding her every time I speak to her.
Jake, did you ever use ultrasound in your surgical training at all? Was it a tool that you?
Very, very, very infrequently. So even when we did, for example, I did a lot of vascular work, but, you know, when we had to map out the varicose veins pre, you know, stripping or lasering, whatever, they would go to an ultrasonographer and they would have their venous duplex. So that wasn't me, but, you know, occasionally you get exposed to interpreting, you know, what was seen, but certainly no hands-on. Probably the last time I remember even seeing an ultrasound in hospital was in trauma, you know, when a sort of a trauma patient comes in, you're doing a fast scan of the abdomen, but nothing of the face. And in fact, I'm even having radiologists reaching out to me. I had a guy from Iraq reach out to the course that we just held here, because he thought it was for radiologists, because none of the radiologists know how to look into a face. It's just not a modality.
It's absolutely astounding. I mean, this is a really strong point, which is why every week we just come on and just chat about ultrasound and aesthetics. The fact that radiologists are, you know, there's no cutting edge, there's no spear point, there's no edge. Literally, it's the Wild West. And as we carry on progressing, you know, we're discovering more and more that, you know, just like you said, radiologists are now coming to you, who's not an ultrasound specialist, but also an aesthetic specialist, and asking for advice and guidance. I mean, that's amazing.
Fly from Iraq to Sydney.
Yeah.
And I was like, look, I don't want to over call this or overstate this, but this isn't for radiologists. But I mean, you are welcome, but I just felt uncomfortable, you know, sort of almost teaching what he would then take back to a non-injecting job. That was really why I felt uncomfortable. But yeah, it's amazing. You know, Mobin sort of had to work it out for himself, sort of from first principles of being an injector and then understanding MRI and sort of piecing it back to ultrasound. So I think we're all learning, to be completely honest. And Leonie and Peter, they told me it took them years. They were just messing around, kind of, you know, they put the scanner over the forehead and they were like, right, well, we've got an anatomy book, let's work out what's what.
Yeah.
You know, and I actually think that's part of the intuition of teaching new injectors how to use ultrasound. You know, you can put a probe on the face and it'd be like, okay, well, you know the masseter's there, right? So bite, and that thing wiggling when you bite, that's the masseter. So now you know what muscle looks like, or a big muscle. You know, you can work these things out from first principle. And I think a lot of new injectors, when I say the word ultrasound, they kind of go, oh God, because they think they're going to have to learn all this new anatomy. And I'm like, no, you know this. You're just seeing it in a different way. And it's actually really cool to see it, because it's not like the textbook, it's actually real.
What was it like at the beginning when you first started using ultrasound? I'm assuming you're using ultrasound a little bit in your own work here, Jake, over the last few months, where you're starting to use ultrasound for patient assessments.
Yeah, look, I want to make it really clear, I'm at the start of my journey, but at the same time, I think it's been powerful how different my practice is now. So, you know, the learning curve is hugely steep, but even after, you know, an hour with Leonie in Paris and then, you know, doing the online course with Cutaneous prior to hosting their course and absorbing that knowledge, you know, you immediately walk into your clinic with some skill. Like I mentioned, the masseter. You know, you can do live injecting of a masseter after about 5 minutes of looking at a masseter because it's just so bloody obvious. Same for, say, a fixed point like the temple or the swift point. A lot of people inject the swift point, and you know, I'm not criticizing the technique, but you know, it's said that, oh, there's no artery there. Well, if you put your scanner on and have a look and you see a deep anterior artery, well, you know, you've potentially saved someone's eye in 1 second just by putting the scanner on for 10 seconds and clicking Doppler. So
Yeah.
I think there's some real practical benefits, even if, you know, you're not a master at ultrasound. And I think, you know, I wouldn't even call myself intermediate. I'm still learning lots and lots and lots. I don't use it on every patient because, you know, if I've got a day of half toxin patients and half filler, well, half of those I'll skip the scanner, even though I do think there's some relevance for using a scanner maybe in the lower face, you know, to try and avoid some of these sort of rare but, you know, significant complications like a funny smile after a masseter or doing a DAO. So yeah, look, I think we're all learning, but at the same time, it's not too difficult. You can take away some skill from day one. That's my opinion.
Yeah. Have your patients got any particular views of you using the ultrasound on them? Have they thought that's a bit odd, or is that effective? Is it going to help me? Have they got any specific views about you using the ultrasound?
It's funny. I mean, the first week that I had the scanner, obviously I put some stuff on my website that it's available. Not in any great way. I think I just added it to the price list for complications. I don't charge for it in, you know, just routine use. I just see that as a point of difference, and it's part of my injecting. I wouldn't charge for extra needles or a TSK cannula. So I'm not going to charge to use an ultrasound. That's me investing in my work. But you know, if someone comes along for something, you know, that I didn't do, and they want me to have a look at their face, then I'll charge for that sort of service and potentially Hylays. And yeah, I mean, sorry, I forgot the question now. Going off on tangents here.
Just about the patients, Jake, just about the people that you treat.
Yeah.
What were their views of it?
Yeah, and so literally that first week I had, I can't remember, it was 2 or 3 people book in for weird and wonderful lumps or funny tear troughs. I actually inherited a patient who has sort of a chronic puffiness just unilaterally under her one eye. And, you know, I'm still treating. I've seen a few times now, scanning, identifying blobs of filler, doing small targeted drops of Hyalays, she gets a temporary improvement, then it's back. So I think her case is more complicated. I think there's lymphatic involvement as well. But the other patients, you know, I could just see a blob of filler, we dissolve it, and hey presto, they're happy. So yes, immediately the patients were booking in specifically because of the service, because it's not available pretty much, well, there's a handful of us doing it. I reckon there's probably less than 30 in the whole of Australia doing it, you know, regularly in their clinic. So it's still quite small. I've got the odd patient, you know, they've been regulars, and I said, hey, do you know what? I've got this scanner. Let's just have a look at your temples, because I've been doing your temples for 4 years now. But let's actually have a look and see, and see what we've been playing roulette with. I've actually got one patient, of course I won't mention her name, but every time she comes, she says to me, Dr. Jake, in fact, she calls me Dr. Evil. She thinks I'm evil.
Interesting, interesting.
Yeah. She said, every time she sees me pre-ultrasound, she said, is today the day that I'm going blind? And I was like, oh my God, like, you know, we really don't want to be talking in those ways. But she's joking, but she's serious. She's terrified, but she wanted her temples done because they're quite hollow. Yeah. Whereas now I can actually look in her temples and say, look, see that wiggly thing that's, you know, brightening up, or that's superficial, and we're going to go deep, or vice versa. So, you know, I think patients love it because they, you know, they might not understand what's on the screen, but they love the fact that you do, and you can explain it to them, and they feel like they're in better hands. I think it's great.
I think that's Jay, that's a really important point about the patient coming into you and saying, is this the day that I'm going to go blind? I think for practitioners watching, and there's a question actually from a practitioner, but it's a really good point that when you see a healthcare professional, every day that, I mean, I'm speaking from personal point of view, every day you go in and you're doing fillers, you are actually thinking, am I on point? Am I focused? Is my training sound? Is my technique sound? Have I got everything I need? Because I don't want that to happen today. And I think that is the difference between a healthcare professional who understands their anatomy, their technique, and constantly investing in their technique. So, you know, for everyone that's watching, we talk about filler anxiety. It's natural, so don't be afraid of it. It just keeps you focused. And obviously Jake is sort of in a way highlighting that, you know, the patients will say it, but we feel it as well. I'm sure you guys will agree. There's a quick question actually from Harley Street Emporium, who I don't know who that is in a person, but they said they did an interview with Mobin a few years back on doctors, healthcare professionals using ultrasound in aesthetics. So it's supposed to be aesthetic doctors here in London, and they showed no interest whatsoever. So, I mean, how as a, I guess I'm going to label you as an influencer, sorry mate, but how do you sort of change the mindset of the industry, the doctors, the healthcare professionals, that, you know, this is something that is useful?
Look, I prefer to lead by example. I'm not going to hit people over the head with it and say, you've got to learn, you're rubbish or unsafe if you don't. But at the same time, you know, if I can say myself confidently, hand on heart, that, you know, I just gave you a great example. You just put a scanner on the temple, and if there's a deep artery, I'm not going to do a gunshot technique. I'm just not going to do it. So, you know, I tell you what surprised me, or not surprised me, it was quite nice, I guess, is the people who came to the course a couple of weeks ago. You know, they're all experienced injectors, and some, I think one of them you've even had on your interviews, Martina. You know, as soon as they put the scanner on, they see a few arteries firing off, and they go, holy shit, I cannot believe that yesterday I would have confidently said, oh, I'm on bone, I've aspirated, so I'm safe. So, you know, I think it's quite a humbling experience to put a scanner on a face and actually see what's in there. It's a bit like, you know, you go swimming in the ocean here in Sydney, and then suddenly you can see the sharks. You wouldn't go in the ocean. So I thought that it's a good analogy, because, you know, we know the sharks are in there, you just don't know where they are.
Brilliant analogy.
Same for the arteries. So, look, I think it's going to be a slow burn here. I think there's a lot of, whether it's overt resistance or just hesitancy, I think for a lot of injectors, because we haven't been exposed to it, because we've had no courses, you know, it really wasn't a thing pre-COVID here. There are a lot of injectors here sort of going, yeah, I've heard of this ultrasound thing, but I'm kind of fine as I am, so why should I? that's sort of the attitude. You do get people really interested, but they don't know where to start, and hopefully I can help with that in the future. What I have noticed is that it seems to be more doctors and even dentists who are quite keen to sort of get their hands on it. And there's a couple of theories why that is. I think one, you know, doctors want to differentiate themselves. That's not to say that nurses wouldn't want to. But I guess the quirk here, and I don't know if it's the same in the UK and other countries, is that registered nurses who work here in Australia as injectors, they have to have a supporting doctor who prescribes for them. So it's almost by default the doctor who may get involved when there's a serious complication, whereas, you know, some of the nurses, maybe the more junior ones, don't see maybe a need to sort of complicate things when they're still trying to learn to inject, let alone, you know, add in something like ultrasound. So I do understand that, and I mean, I'm going to turn into the host now. When do you think that people should sort of add this into their journey?
Go on, Viv.
Well, it's for us. We started earlier this year with ultrasound, using it after finding out more about it last year, speaking to Leonie. I'm a member of CMAC, as you are as well, I think, Jake and Sunny. We're all members of CMAC, Collaborative in Medical Aesthetic Complications. And they had the live last year with Leonie talking about ultrasound, and that's how I first came across it. And for me, it was a no-brainer. You know, we're injecting every day. We can't see under the skin. We know what the anatomy should be, but we don't know for sure. And if something like an ultrasound device can help us minimise risk to the patient, and if it can help us sleep more confidently and easily at night, it's all go for me. Same for both of you, I'm assuming.
So I think it was imposter syndrome for me. So imposter syndrome kicked in, and I saw something shiny. So I was like, if I invest in this, I can take my imposter syndrome down by about 10%, because it will just help me. So you nailed it when you said differentiation. Of course, how do you differentiate yourself? How do you make yourself look that little bit more established? And then, you know, the resources there. And I think I watched a webinar, and then I got retargeted by Google Ads, YouTube, and wherever else there. So I was sucked in. But I think there's a question I wanted to ask you, Jake, was that, I mean, when a concept comes into play in your mind, and this is really good for everyone who's watching, is when a concept comes to play in your mind, you start visualizing what can be done. And I think that's what makes us different as injectors, because there's a certain level of artistry involved in aesthetics, and that creative element comes into mind. So for me, it was, what can I achieve with this in the future? What could this mean for, obviously, patients? What could this mean for me injecting? And I think that's where it was cemented in straight away. Obviously, the reality of it is, I had to suggest this to Viv. Viv got roped into it, and now we're here every week talking about it.
But it's fun to be able to talk about what we come across about our own journey, and hopefully it'll give others an idea of what's involved and what problems, what issues come across using ultrasound, and the benefits of it as well. And for me, I've quite enjoyed it because it lets me reflect on the work I'm doing, and helps me to look at what I can do in the future as well by doing these things.
So Jake, what does the future sort of hold in terms of how you sort of, you know, I've looked at your feed, I've listened to the podcast, you know, as you've grown as an injector, as an aesthetic practitioner, as a business entrepreneur, whatever labels we can throw at you, you can see that structure coming through, and that message is clear. What does the future hold for you then with aesthetics and ultrasound? Is it going to be developing the course more? Is it concentrating on complications in clinic? What's the future holding?
To be honest, I think it's all of that. I've got a lot of messages post the course saying, "Oh, hey, that looked awesome. When's the next one?" and the truth is, I might as well just say it, I don't know, because it was the first standalone cutaneous facial ultrasound course this part of the world. I heavily relied on Peter coming here physically in person with his colleague Tatiana, who was amazing. What we hope to do is to sort of stand alone and, you know, use my early skill, maybe Stefania Roberts' skill if she's keen to come on. She taught for them on a second course here a few days after I did. If I can con Mobin into coming and helping, then Mobin, if you're listening, you're coming. So, you know, I need to really pull the Australian experience together to have any chance of sort of, you know, getting on the front foot and actually making this something sustainable with momentum. If we just do a one-off course and then say, oh, that's it, no more, I think we're just going to be flapping around for the next couple of years, not really getting anywhere. So I'm keen, maybe take it to a different city. We've had a number of courses in Sydney just in the last couple of weeks. We had a number of conferences, sort of, you know, one after each other. So there are about 3 or 4 ultrasound courses in a row. And that was problematic in itself, because then it sort of saturated the demand, and it sort of didn't feel like a special thing where people were looking forward to it. And it was taught by a number of different people, so it might have muddied the waters. But you know, all the courses were good. They were just slightly different in how they were sort of rolled out.
Here's a suggestion for you. It's a selfish suggestion. Why don't you get a beginner's course, intermediate and advanced all together, probably about 3 or 4 days, and that means those of us in the UK can swing it as a business trip and fly all the way to Sydney. Just get the
you just want to go to the beach and have a beer, don't you?
Well, look, listen, it's your fault. It's your fault. You posted pictures of Bondi Beach, I think 2 days ago, yesterday or day. You took the kids there.
Well, what you didn't get from the photos, it was bloody freezing.
Okay.
Actually, look, it was nice in the sun, but as soon as you're in the shade, you're absolutely freezing your ass off. But yeah, I'd love to have you guys over. It'd be great. Yeah, look, I'm sure it will happen. It's just a case of doing the right thing and getting the right experience together and giving the attendees what they deserve. To be completely honest, that would be my hesitancy. I can't do it on my own. I don't have the experience yet. But what I did hopefully give the attendees when they came, of course, it was Peter and Tatiana mainly teaching. But being an early adopter who just, you know, 4 or 5 months ago was in their shoes knowing nothing, it's easy for me to translate some of the really simple things that they just weren't doing properly, that maybe an experienced sort of trainer just can't see. They just can't see, you know, for example, a common thing that early ultrasounders do is they sort of hover around in the air without a stable point. So I was just teaching them, look, just put your little pinky on the face, hold the scanner with the rest of your fingers, and then you're sorted. You're not wobbling around. But I think experienced trainers just sort of assume that it's happening. So, you know, hopefully as an inexperienced but slightly more advanced trainer, I gave, you know, some input where I could, and everyone enjoyed it. Everyone loved it. So, yeah.
Great. No, it's been, one of the things you mentioned earlier on, Jake, was about the slight hierarchy issue with nurses needing a doctor for particular issues in aesthetics work. It was just a quick question about the market compared to the UK. As we all know, it's a free-for-all in the UK in terms of carrying out aesthetic treatments on the public. In Australia, there is a legal professional hierarchy involved in who carries out what. How does that work? And also, how does that influence training? You also mentioned you tend to get more practitioners who are individual doctors and dentists, not group clinic owners that were involved in training for ultrasound. How does the hierarchy and the difference between individual practitioners and group clinics differ? How does that work?
It's quite different superficially, but I guess at the end of the day, you know, we're all just injectors trying to, you know, do our best for our patients. But here we have, obviously we've mentioned registered nurses. They form the bulk of the injecting sort of cohort. I reckon 85% of injectors are probably registered nurses. Of course, you've got aesthetic doctors like myself, nurse practitioners. They're nurses who have done a master's in a specialty. There's, you know, they only form about 2% of nurses, I believe, is a very small cohort. And then the dentists do form another cohort, but unlike in the UK, where there's plenty of dentists in aesthetics, and there's some really prominent ones, Lee Walker, we've got MJ, who's well known for ultrasound work. Here in Australia, the dentists sort of sit in a very unusual grey zone. They're neither accepted nor not accepted, and that's partly to do with their own regulatory body sort of having a problem with what they're doing in their scope of practice. So you know, I won't dwell on that, but, you know, there are some very skilled dentists here, but it's a little bit against them until, you know, those regulatory things sort of get a little bit more formalized for them. The other big dynamic, which is quite different, although I know it's actually started in the UK, is the chain clinic phenomenon. So, you know, what I mean by a chain clinic is a multi-franchise model of clinics who offer aesthetics. And you guys now have LC UK. I don't know if you've come across them, but they're sort of popping up like mushrooms. I think there's about 50 in the UK now. We've got about 148 here in Australia, which is, you know, a small country. We've got about, you know, 1/3 of the population of the UK, but we've got 148 just of that chain of clinics, and there are multiple other chain clinics around the country. So the pros of that is it's made aesthetics accessible to anyone, literally anyone, because the price point is good. They're available everywhere. You go to any shopping mall or any, you know, shopping high street, you'll find multiple aesthetic clinics. So the availability is pretty much everywhere, including the rural areas now. So I think that's democratized aesthetics. It's made it available to your average person, which is brilliant. Of course, there are questions about quality. How do you roll out quality over, you know, 150 clinics and so on? But, you know, truth be told, I worked at one of these clinics, and, you know, that's how I learned a lot of my skill, and I was sort of, I guess, identified by Allergan through working there. So I'm not knocking it, I'm just saying it's very different. And so, you know, to roll out something like ultrasound in a multi-franchise clinic with 150 clinics, I don't see how that works personally. That is something that I haven't quite squared yet. Whereas for your individual injector, nurse or doctor or dentist, they can easily go and learn and bring that straight back to their clinic and start working.
That's a great insight. That's a really good insight. Thank you, Jake. Thank you.
Yeah, we've pretty much covered everything that we wanted to talk about, I think, Jake. Podcast.
Plug
you
the
know
podcast.
What? I even mentioned it before you came up, in fact. So let me just mention Jake, as everyone should know, he is the co-host of Inside Aesthetics podcast, and David there, his co-host partner, both run Inside Aesthetics. Follow them. I follow you. It's a really good podcast to listen to. When you talk about, as you say, it's your own views of different aspects of aesthetics. You're not forcing your opinion on anyone. People can think what they like, and you're not acting like a key opinion leader as such in a broad sense. You may well be working with Allergan, but you enjoy talking to different practitioners around the world. You speak to doctors, dentists, nurses, pharmacists, all sorts of different practitioners, and it's interesting to hear what people think about your podcast as well. I enjoy listening to it every week. I don't know if Sunny's listened to much of it.
I listen to it on the way into work. I grab 10 minutes, 15 minutes, and I listen on the way back again. So my journey is about 15 minutes. But you know what? I would definitely recommend, if you, instead of listening to the news or listening to music, listen to Inside Aesthetics. Or obviously there are other good podcasts are available as well, but this one's probably the better one, or the best one. But just listening in 15 minutes, you know, it just helps you focus for the day, because it's a genuine interest and passion. And sometimes when you're driving into work, you're a little bit jaded. You know, the sun's not shining, it's raining. You know, you've escaped all that, Jake. But miserable weather. But you know, you listen to that sunny vibe coming from Australia in the morning. It does set you up for the day. So I definitely recommend it for you guys who are watching now, who are not, who haven't listened to it already. But I know you've got a massive following here.
Feedback, guys. Yeah. How did you come across it? I'm curious.
I personally came across it, but with other followers following you when they just mentioned it. I looked at it, followed it, and then I came across you on Instagram. And we've been having chats about all sorts of stuff over the last few weeks, I think, about aesthetics-related topics. But I just enjoy listening to it. It's fun. It just gets you in a good mood. And it makes you think about different things concerning aesthetics that you may not have come across or may not have thought about. For example, you've got Martina Lavery, you've had her on, who's a dentist in Sydney, and she'll be joining us next Thursday at 8:30. And it'll be interesting to hear her views of aesthetics and using ultrasound. I think she's at a beauty expo today in Australia somewhere, talking about masseter treatment in patients. I think she's busy doing that today. But I love it. I think everyone should listen to what you do, the two of you, David, and all your guests on Inside Aesthetics podcasts. Follow them on Instagram and go to the website. You've got a Patreon account as well, I think, for any individuals that want to sign up and get inside info about your podcast as well. Is that right?
Yeah, thanks, Les. You have to wire me your bank details and I'll get later.
Listen, Jake, just like in aesthetics, we're non-for-profit, basically. So, yeah.
No, I genuinely appreciate the feedback. It's really nice to hear it. That's all we want. It should be fun, but engaging, entertaining. That's all we can ask for. And we're not the experts. I mean, you said, Viv, I hope I don't represent myself as a KOL on the podcast, because when I represent any company, whether it's Allergan or Profilo, who I'm now training for, that's in a standalone classroom when I'm representing that company, and I do things on label the way the class is supposed to be delivered. But outside of that room, I'm free to talk about, what I like. So, I was supposed to do a live with Tim Pierce a couple of weeks ago where we spoke about this whole KOL thing. And I think a lot of people sort of get labeled as, you're Mr. So-and-so, you're Mr. Allergan, you're Mr. Galderma. And hopefully the podcast shows that I'm just an injector who's interested and intrigued and like talking to cool guests. It's not about me or David, it's about the guest most of the time.
Yeah, no, it's been good. I've had a great 40 odd minutes with you, I think, Jake. It's been a good time. Really, just to sum up, I just wondered, in your own experience, based on your training provision, based on you being a cosmetic doctor using ultrasound, starting to use it, what would be your advice to other practitioners, perhaps, who might be considering using ultrasound in their own work? In a few simple sentences, what would you say to them?
Well, not to plug my course, but there aren't many courses around. So when a course comes around, whoever is teaching, go on it and go there with an open mind. And one of the things that I've heard from people that holds them back is they're like, I'm going to have to invest in a $10,000 device, and it seems all too expensive and stuff. So don't commit to that. Just go and see if it's for you. See how valuable or not valuable it will be to your practice. But I mean, it's a bit like when our cars didn't have rear view cameras and beepers, and parking, half the time you're scraping your alloys on the curb, and you're kind of guessing half of the time. Well, I sort of liken ultrasound to that. Now you've got some sensors and you can see what's going on. You can look around the car, and I hate using the word, but you're definitely safer. So if you like injecting not blindfolded, it's probably going to be for you.
Jake, you are the king of analogies. I mean, swimming in the ocean with sharks, and now the car analogy. I have to go back through the video and trademark some of these.
I actually have to say I use analogies a lot with patients, because they just get it. Whereas if I sit there talking about filariology and shitting on about anatomy, it doesn't always work. But I think an analogy really helps. It makes the penny drop. So
I've got a slight niche question. I mean, this is fascinating. We've gone way over time, but I'll ask you anyway. Will working in aesthetics, Jake, allow you to buy a house in Piper Point?
Not Piper Point. It's actually Point Piper.
Point Piper. Point Piper.
Definitely not. Those houses are about 20+ million.
For anyone wondering about that question, I got obsessed with Sydney Lux, which is a real estate. So I had to get in there
as well.
So
no, sadly not. Well, look, it depends how much. I can't say the name. The P word. I'm leaning across tomorrow.
No, that's joking aside. It's not. No, but I mean, anyone who wants to get enamored with Sydney, listen to the podcast and then watch Sydney Lux afterwards. Then you'll be obsessed, as I have become.
Have you guys been to Australia ever?
Never had a chance. I worked when I was deployed with the army in Afghanistan. There was a big Australian contingent. So I heard all about Australia, but it's next on the list. I mean, obviously, when you've got the multi-course set up, We'll be there.
Yeah,
We'll be
that'd
there.
be awesome.
Yeah.
And yeah, this has got nothing to do with me, but if you want to come to a cool conference, we've just had what was known as A22. Come to A23 next August. I'm telling you now, it will blow any conference away in terms of its, well, fun, but also the little hints and tips and golden nuggets that you'll take away. So,
Viv, how about that? Right? Should we try and present at A23? The fun guys.
It'd be great to pop over to Australia just to see Jake, no matter anything else. It'd be nice to see him.
Well, there was only a tiny component in the whole conference, even a very modern, cutting-edge conference about ultrasound. So I do hope that it's showcased a lot more and becomes more normal rather than kind of this weird thing that gets tacked on as a little 5-minute aside. I think, that was the great thing at IMCAS. I don't know if you guys watched or went, but during the dissection sort of part of the conference, which is probably the biggest attended, is a room of about 1,000 people, whatever. What would happen is the ultrasound guys, Leone, Peter, Steve Weiner, etc., they would scan a face, talk about the anatomy, etc., and then Sebastian Cotofano would look at the cadaver and sort of show people. So these things were sort of brought together as one thing, not either a cadaver or ultrasound. It was just both, and I thought that was great.
I mean, that's great insight. I mean, basically for us, ultrasound is that bridge, isn't it? We're doing something that's non-invasive. Well, now we've got a non-invasive scanning technique that's now freely available. Well, not freely, but it's available to us in clinic. This has been really enjoyable. Viv, I'll let you wrap up because otherwise I'll start asking random questions.
Just both of us, really, Jake, really wanted to thank you massively for joining us all the way from Australia. And we'll hopefully meet up again. We'll hopefully meet up again face to face next time at some point in the future. I was going to mention about training. You mentioned your training will progress in Australia and across the country in different cities probably over the next year. As members of CMAC, the Collaborative for Medical Aesthetics Complications, we've got Leone in November the 18th, I think it's a Friday, who's providing training at CMAC in London at the IET for anyone who's interested. You don't have to be a CMAC member, but you'll get a discount if you are. And I think she's there for a day. She's also at the CMAC conference for 2 days following that, and that's on the 19th and 20th of November. It's a shame you're not going to be there. I was gutted that you're not going to be there, but CMAC have been posting about practitioners who will be providing information at the conference. You're going to be doing it sat at home or in your clinic from Australia, aren't you, Jake?
Well, unless we can bully CMAC to fund my trip over first class with champagne, yeah, it looks like I'll be sat in this is my clinic room, or one of my clinic rooms, so I'll probably be doing it from here. Yeah, I'm really talking about complications of fat dissolving injections, and the brand that I use is Balkyra. I know you guys have got a couple of brands in Europe, but I'll just be talking about that because it's quite a niche topic. There aren't many practitioners who I think use it well. I know in the UK there's a lot of people just sort of messing around with some of these products and potentially not being fully trained. So it's quite a niche talk, but yeah, I'll be doing about a 20-minute talk on complications of fat dissolving.
Great, great. That's it. Any last words you wanted to say about anything to do with our chat today, Jake?
Well, no, just to extend my thanks, Viv and Sunny. Thanks for inviting me. I can't believe you invited me on as an expert in ultrasound. I'm very, very early on in my journey. I just sort of clarify that again if anyone's just joined us. If you do want to follow the podcast or listen to the podcast, it's all free. The easiest way to subscribe is just go to @InsideAestheticsPodcast on Instagram. There's a link in the bio, and then you can get the information there. And yeah, I wish you guys well. Thank you for having me, and a pleasure talking.
Thank you.
Great, thanks a lot. And thanks for everyone who's joined us today, who's watched the live today. It'll be on YouTube, it'll be on a podcast and all the podcast channels as well. I just wanted to say next Thursday at 8:30 UK time, 5:30 in the morning Australia time. I don't know why she wants to do it, but she does.
The alarm's already going on, don't you worry.
Got Dr. Martina Lavery, who's a dentist who specialises in cosmetic dentistry, and does a lot of aesthetics work as well. We'll be having a good chat with her at that time, and I hope you have a great week, Jake, and I hope Sunny we'll all meet up again at some point in the future. But we'll be back next Thursday, and we'll listen to your podcasts over the next few Fridays, Jake. It's nice speaking to you.
Bye, Jake. Thanks very much.
Bye-bye.
Thanks a lot.
Bye-bye.
See ya.
Bye-bye.